Welcome back. The distribution of COVID-19 vaccines is now underway, and joining us to talk about what the vaccine rollouts mean for communities of color is KUSI political contributor Esther Valdes Clayton. Esther, good morning. Good to see you.
Good morning, Lauren.
So we know, as we followed along with this pandemic, that communities of color are being impacted more. The death rate is higher, and yet we're hoping to get this message out to these communities so that they take the vaccine. What are we seeing still as far as the disproportionality of how those communities are being affected?
Well, the numbers that are often cited, such as in sources like the Sacramento Bee, are showing that Latino and Black populations in the state of California are 3 times more likely to die from coronavirus-related deaths. What that doesn't mean is that Black and Latinos, by virtue of their skin color or their ethnicity, are somehow more susceptible to this virus. But a lot of people are conflating the two things, especially when we talk about the vaccine rollout. The underlying issues that face Black and Latino populations are still largely unaddressed, such as crowded housing, poverty, obesity rates, low availability to good nutritional sources, the lack of exercise or mobility, intergenerational housing. All of that are societal and social economic issues that are not being played out or being addressed by the governor. What California Governor Newsom has suggested, in accordance with CDC guidelines, that over half of U.S. states are now trying to roll out the vaccine in terms of racial equity. That is, prioritizing Latino and Black populations to take the vaccine first. And of course, that is being met with a lot of hesitance in those communities, precisely because of the historical significance in the United States dating back to racial segregation period, where there were experiments on Black men on syphilis, known as the Tuskegee experiment, where Black men were knowingly infected with syphilis, and many died due to a government experiment that was conducted on Black communities. So there is a lot of hesitancy with this racial rollout, but also a lot of pushback, even among other racial groups that also want access to the vaccine, such as the Asian and Pacific Islander community. They too are often essential workers. They're frontline workers in the hospital and in the medical field. And they're saying, why the disparity? Why are you choosing one skin color over another? And of course, there's frontline workers, essential workers in the schools as well. And of course, we must not forget that age is a huge factor in terms of diagnosing who is going to have a morbidity rate that is higher, and our elderly are being pushed back in accordance with this racial equity that's gone awry.
And let's touch on the trust issue that you mentioned just a moment ago, because some of these studies are showing that just 14% of Black adults and 34% of Latinos are saying that they trust the vaccine's safety. That doesn't bode a lot of confidence for this. So is there messaging that's trying to address those communities to hopefully boost the confidence in the vaccine, or what is being done to address the communities and educate them on the safety of the vaccine?
There's messaging and skepticism. Like I addressed, the historical significance of pushing racial minorities first in line, especially for the Black community. We have cases such as the very well-known case of Henrietta Lacks, that she was used for science and for experimentation without necessarily her consent and her knowledge. There's that kind of historical distrust, but also just the wherewithal of the average citizen just asking how quickly this vaccine was rolled out. We don't know, especially what the effects on children is going to be, on pregnant women, on their progeny, because it was just rolled out in lightning speed. So especially for Latina women, the surveys are showing that they have a higher rate of skepticism. But not only that, but when you see this number of hesitancy, you're also going to see a number of messaging. And if you noticed, the first televised vaccination in the United States was an African-American nurse injecting an African-American patient. So there's going to be a lot of disproportionate amount of influence on Black and Latino communities to get this vaccine without really addressing the fact that, wow, maybe we want the poverty, the socioeconomic status, the housing issues addressed, the lack of health insurance coverage, the lack of health equity that is really at the core of morbidity. A lot of people are conflating when we're talking about these conversations that all of a sudden Black and Latinos, by virtue of your skin color, you're somehow going to die 3 times higher if you're infected with coronavirus rate. And that is not the case. There's Latino and Blacks and Asians and Pacific Islanders of all income levels. They shouldn't necessarily be pushed in line ahead of people who are in the front lines in the hospitals, teachers, firefighters, police officers as well. There's a slew of interests that also need to be protected as well, especially, like I mentioned before, our elderly. But a lot of this conversation, when it becomes race-based, is edging out all other voices. And like I said, it's not necessarily a good conversation.
Well, we'll see how this rollout continues and what the governor actually decides to do. I mean, he said last month that Black and Latino residents who've been disproportionately affected should be inoculated first. But we'll see how this rollout continues. Esther, thank you so much. Appreciate it.
Thank you.